This is a Chapter 12 review of the integumentary system for medical terminology. So we're going to start again with related combining forms. There's quite a few for the skin. So cutaneo, dermato, and dermo. And again, we have a couple for the nails, which is onycho and ungio. So the integumentary system consists of the skin and all of the related structures. And those structures are the sebaceous glands, the sweat glands, the hair, and the nails. The integumentary system is the largest body system because it has about 2 square yards of skin. So when we look at the largest body system, it is indeed the integumentary system. The function, there's a number of different functions of the skin. It helps keep our body waterproofed so we don't have massive fluid loss. When we have intact skin, which means we have no openings, no cuts, scrapes, anything like that, it actually blocks the path of the pathogens. And so it actually helps us fight disease by being able to keep those pathogens out. It also contains receptors for touch. It helps us synthesize vitamin D from the sun. And the other thing that it does, although it's not listed, is it helps keep us warm, because in the one layer of skin that we'll be talking about, there is that layer of adipose or fat that helps us keep our body nice and toasty. Sometimes too toasty if you have too much fat. Sebaceous glands. Sebaceous glands actually secrete sebum, which is like an oily substance that comes out. And what that does, it helps lubricate the skin, keeps our skin nice and supple, but it also discourages the growth of bacteria on the skin. The sweat glands actually help us with our temperature regulation. When we get hot, we sweat, and the sweat then evaporates, which cools our body. This is a really important feature because there are people that don't have the ability to sweat. And when that happens, their body temperature rises and it can be very dangerous. The sweat glands also excrete small amounts of metabolic wastes. The hair on our body helps control the loss of body heat. And you know that if you know anybody that shaves their head or is bald, they get very, very cold. They've always got a cap on of some kind because they're trying to keep their head warm. The same thing with babies. We keep hats on the little ones because we want to make sure we're helping them maintain their body temperature. And the nails protect the dorsal surface of the last bone on each finger and each toe. There's 3 layers of skin: the epidermis, the dermis, and the subcutaneous. So when we look here, you can see the first top layer of skin is called the epidermis. The next layer of skin is the dermis. And this is going to be where the blood vessels are, the sweat glands, the hair follicles, the sebaceous glands. Then we have this beautiful little layer of fat right here, which is the subcutaneous level. Layer, excuse me, again, helping us maintain body heat, those type things. And then we have the muscle. The epidermis, again, is the outermost layer of skin. There's no blood vessels or connective tissue in that. It is totally dependent on the lower layers of the skin for its nourishment. Okay. There are epithelial cells in the epidermis, and again, they are protecting our internal and external surfaces of the body. So again, that's protecting our little organs and our vital organs. The squamous epithelial actually form the upper layer of the epidermis. And these are flat, scaly cells, and they shed. And you can tell that, especially in the winter, we get the dry, flaky skin. But again, it's falling off and constantly being replaced. The lower level of the epidermis is the basal layer. This is where those cells, the new cells, grow. And then as they go up, they get sloughed off. When they reach the surface, those cells do die and they become filled with keratin. And what keratin is a fibrous water water repellent protein. And there's two different kinds that we're going to see. There's a soft keratin, which is what we see in the epidermis, but our hard keratin is found in our nails and our hair. There's melanocytes. That's a special cell in the basal level or layer. It actually is what produces the pigment in our skin, and that's melanin. So the more melanocytes that you have, the darker your skin will be. Okay. Again, some of those pigments actually help protect our skin from those harmful UV rays. So when you see somebody like me who's pasty white, and even with major sunscreen, I go out in the sun and I get sunburned very, very easily. Again, I don't have a lot of melanin in my, I don't have a lot of pigment, okay? Other people like my husband who has darker skin can go lube up with oil and he gets this beautiful tan. That does not happen with me. I turn from white to bright red with a burn, peel, and go back to white. The dermis is right below the epidermis. Remember, if we look at that term, it's above the dermis for epidermis. Our dermis contains the connective tissues, the blood and lymph vessels, the nerve fibers, hair follicles, the sebaceous and the sweat glands. This is also where our sensory nerve endings are. So this is where we're going to feel pain, pressure, and also temperature, either hot or cold. Tissues that are in the dermis are collagen. These are tough fibrous protein, and we find this in the bones, the cartilages, the tendons, and the ligaments. We also have mast cells in the connective tissue in the dermis. And what the mast cells do, they are there to respond to either an injury, an infection, or an allergy. If there is an injury, it's going to release heparin, which is like an anticoagulant. It's going to bleed. We're going to, have that issue. And with an allergy, it's going to release histamines. So when it itches, when we get that mosquito bite, those mast cells come in, and that's what makes that mosquito bite itch so badly. Subcutaneous layer is located beneath the epidermis and the dermis. This is the layer that connects the skin to the surface muscles. It is made of loose connective tissue and adipose tissue. Lipocytes manufacture and store large quantities of fat. So lipo is the combining form for fat. Sebaceous glands that are located in the dermis, they are closely related to the hair follicles. Again, we talked about this. The sebum is like an oily substance, and it actually is released through ducts open into the hair follicle. And so when we get like a pimple, that's that backup of dirt and oil. That's what happens. It blocks the pore, and then we can have issues. That sebum helps lubricate our skin, and because of the acidity of it, it also discourages the growth of bacteria on the skin. Mammary glands are also considered a sebaceous gland because they produce milk, and we'll talk about this a little bit in the reproductive system as well. Sweat glands are pores that open on the surface of the skin. They act as ducts to the sweat glands. And when we get hot, we perspire. And that's when that sweat is secreted through the sweat gland. 99% of that is water, but there is some salt and some metabolic waste. And we talked about that to help cool the body. We sweat. it evaporates, and that actually helps cool the body down, cools the temperature of the body down. Hydrosis is the production and excretion of perspiration. So that is sweating. That's the term we correlate to sweating. Hair is composed of dead protein cells that are filled with hard keratin. The color of the, hang on one sec. Sorry, had a telephone call. I usually take my phone off the hook. So the hair is composed of those dead protein cells that are filled with keratin. The color of the hair is actually determined by the melanin. So again, when we have people with darker skin, we see darker hair color as well. Hair follicles are actually the sacs that hold the root of the hair. And the erector pili are actually muscle fibers that are attached to the hair follicle. And this is, remember when you hear the saying, oh my gosh, my hair was standing on end? Well, that's what happens. It actually causes the hair to stand erect, and that helps reduce heat loss. Okay, let's get it switched here. Unguinous fingernails or toenails are a keratin plate that protects the dorsal side of the fingers or the toes. They are translucent. They are molded to the surface of underlying tissue. So you can see here, it's following that tissue line. It's made of hard keratinized plates of epidermal cells. The nail bed is where it joins the nail body to the underlying connective tissue. This is what nourishes the nail and provides the blood vessels provide the nice pink color. Now, when we have somebody who has cyanosis, that means that they have the blood and oxygen is not flowing freely, or they don't have enough. And that's when we start to see a blue pigment to the fingernail beds because they're cyanotic. The free edge is the portion of the nail not attached to the nail bed, and it extends beyond the tip of the finger or the toe. The lunula is the half-moon-shaped region of the nail. The cuticle is the epidermis attached to the surface of the nail, and the nail root is what fastens the nail to the finger or the toe. And if we go back here, you can oops, one too far. Too far. You can see there's the half moon shape that we talked about. Here's our nail root. Here's the free edge of the nail, our nail body, and here's the cuticle. And right underneath there is the nail bed. Specialties in the integumentary system are dermatologists. They are going to be a specialist who treats disorders of the skin. There are plastic surgeons. They are going to specialize in surgical restoration or reconstruction of the body. Now, there is a difference between a plastic surgeon and a cosmetic surgeon. Plastic surgeons are going to fix things like a cut on the face. A cosmetic surgeon performs operations for aesthetics rather than medical reasons. So if we want to get a Brazilian butt lift or a breast enlargement, that would be done under cosmetic surgery. A breast reduction may absolutely be a plastic surgeon, because when women have large breasts, it actually affects the spine. It causes a lot of pain in the back. So I've known a lot of people who have gotten a breast reduction for health reasons. Some of the pathology with the integumentary system is, with the sebaceous gland, is acne vulgaris. Again, too much sebum and oil around the hair shaft, so we get those nasty looking pimples. A comedo is actually a non-infected lesion that has sebum and keratin. A closed is a white head, and open is a black head. An um, epidermal cyst is actually a cyst that's just under the skin. It contains fatty material. And I don't know how many of you guys like to watch Dr. Pimple Popper, but I love it. I think it's fascinating. And we see those a lot in her show, where it's just a lot of fatty tissue that's in that cyst. It can also be solid or semi-solid or liquid material in that as well. Seborrhea is the overproduction of sebum. Seborrheic dermatitis is the inflammation causing the scalp, itching and layers of the skin to peel, and seborrheic keratosis is benign skin growths that have like a waxy appearance. They can be different colors, and we generally see these in older adults. With the sweat glands, anhidrosis, that is a condition of the lack of sweating when someone is hot. This is a real problem. And again, let's look at the medical term, a condition of no sweating. Okay, this is really dangerous because their body temperature goes up and there's no way for them to get cooled down. And so where our bodies normally would sweat, that would evaporate, cool our body, there's no way for this person to get cool. So this is a very dangerous condition. Diaphoresis is profuse sweating. We see this after exercise, but we also see it with certain illnesses or diseases. When somebody's having an MI or a myocardial infarction, heart attack, you'll see them very diaphoretic. That's a term you might hear. A heat rash, it's just a real itchy rash if it's related to this blockage of the sweat glands by bacteria and dead skin. You'll see this a lot, especially in kids, little ones with diapers, those type of things. Hyperhidrosis is excessive sweating in one area or over the whole body. And there are treatments for that. I have seen people have treatments, especially if they have a lot of sweating from the armpits. They've gone in and had surgery to be able to stop the sweating of some of those sweat glands. Sleep hyperhidrosis is sweating, profuse sweating during sleep. Folliculitis is the inflammation of the hair follicle. It's something that you'll hear people call a festered hair. It's just a hair that, and a whitehead will start to grow around it. Trichomycosis axillaris is a superficial bacterial infection of the hair shafts in areas where there's extensive sweat glands. So armpits, those type of things. So people will get a bacterial infection in that area. Hirsutism is hirsutism. I can't even say it. Hirsutism is excessive body and facial hair in women, usually occurring in a male pattern. So these are the bearded ladies that we used to see at the circus, those type of things. Alopecia is partial or complete hair loss. Alopecia areata is an autoimmune disorder that attacks the hair follicles. It can actually be a patch of hair on the scalp, or it could be anywhere else on the body. Alopecia totalis is the loss of all the hair on the scalp. Alopecia universalis is the total loss of hair on all parts of the body. And androgenic alopecia is hair loss due to the hormonal changes, and it can occur both in males and females. Nail clubbing. This is really, really interesting. And I thought I was going to show you a picture, but I guess I didn't. Clubbing nails. Normally our fingernails have a normal curve, but what happens with this is we have oxygen deficiencies to the nails, And instead of them being normal, they kind of flatten out. We see this in our um, heart patients and our COPD patients. It's very, very common. Colonychia is also called spoon nail. It's where the outer surface of the nail is concave. And we see this a lot in people who have iron deficiency anemia. Onychia is an inflammation of the matrix of the nail, and it may result in the total loss of the nail. Onychocryptosis is when the edges of the toenail curve in and cut into the skin. It's also known as an ingrown toenail. Onychomycosis is when we have a fungal infection of the nail, and I'm sure you've seen those fungusy toenails. They get thick and hard and are very difficult to cut. They are very, very, very painful. Paronychia is the infection of the skin fold around the nail. Skin pigmentation issues. For the issues with skin pigmentation, we have acanthosis nigricans. I can't even pronounce that. So it's nigricans. But what this is a development of a dark wart-like patch on one or more areas of the skin. We also have age spots. This is a discoloration caused by sun exposure. We see this a lot in patients who either live in very sunny areas, worked out in the sun during the day, and we worry a little bit about those because we do worry about things like that developing into skin cancer. Albinism is actually a genetic condition that is a lack of pigment in the hair, skin, irises of the eye. So an albino person, you'll see that they have no pigment in their eyes, their hair would be white, and their skin would be very, very light, very fair. With chloasma, it is the brown spots on the face. This can occur during pregnancy and disappear after delivery of the infant. It's pretty cool. It's called the mask of pregnancy as well. It's something that we see, and again, just kind of hopefully goes away after the baby's born. Vitiligo is those irregular patches of white skin, and that's related to the destruction of the melanocytes. It's like a depigmentation of the skin. So you may see dark skin or have a darker patch of skin, and then you'll have a patch of white skin. Bleeding into the skin, there's a number of different things. Again, there's blood vessels here in the skin. And so when we bang our arm or our body part against something, these blood vessels are actually going to break and we're going to cause some damages. So when we look at that, we look at a contusion. A contusion is an injury of the underlying tissue, but it's when we don't break the skin. It's going to be a bruise, okay? Discoloration is caused by an accumulation of blood within the skin. So it's just a bump. You may get a small discoloration. Ecchymosis is different than just a tiny little bruise. Ecchymosis is a large, irregular, purple discoloration, and it's like a major bruise. We're talking about, ramming your arm in the door, or being in a car accident where you have trauma up against the skin. These are the big, ugly looking bruises that we get. Purpura is a multiple purple discoloration on the skin due to bleeding. It is a little bit different when we look at that. They're smaller than ecchymosis, but they're going to be larger than petechiae, which we're going to be talking about here right now. Petechia are small pinpoint hemorrhages, and they're less than 2 millimeters in diameter. This is when it looks like somebody just poked you with a needle all over. We see this in people who, and we can get petechia around the eyes or in the eyes as well, but we see that a lot of times during delivery. When a person is grunting or pushing down too hard, and it can actually break those blood vessels. A hematoma is swelling of clotted blood into trapped tissue, and again, that's going to be usually caused by an injury. Now we get to talk about all these cool surface lesions. And I'm just going to buzz through them. They talk about them in detail in your book. But a macule is a discoloration on the skin. So this is going to be like a freckle. It's not something that's raised. It's just a discoloration on the flat skin. A pustule is a small elevated circumcised lesion that's filled with pus. So when, and I hate that word, but this is a whitehead. So when we push on it, it comes out the pore, and that purulent material comes out. A wheal is actually an elevation of the skin that sometimes is accompanied by itching, urticaria. And so that could be a mosquito bite, those type of things. But we also use a wheal when we're doing a PPD on a patient. We just put the needle right underneath the or the epidermis, and we push a little bit of medicine in, and we form a nice round wheal for it to be absorbed into the skin. An erosion or ulcer is eating away of this tissue, and I have a better picture of a decubitus. A papule is going to be a solid circumscribed elevated area. This is going to be a pimple. Okay, hasn't gotten to be the whitehead yet that a pustule would be, but this is a papule, is a pimple. A crust is like a dry serous or seropurulent type fluid that dries, and it is just really, you can kind of pick it off. You see this a lot with patients with eczema. A nodule is the same type of thing that a papule is, but it's large. So here the papule is small, a nodule is larger than a papule, and this is what we see in acne vulgaris. A scale, again, is a thin, dry flake. You see this a lot in our patients with psoriasis. Vesicle, this is a blister. Okay, it's a small fluid-filled sac. This is what you're going to see when kids have chicken pox. This could be, where your shoes rub and, you get that watery type blister. And a fissure is actually a crack-like sore. And you'll see this a lot in the winter around your fingers, around your toenails, on the heels of your feet when they get extremely dry, and they'll crack, and it can become very, very painful. A cyst is a closed sac or pouch that contains soft or semi-soft materials. We looked at that pustule. It's again, it contains pus. That's the difference. A vesicle is that small, watery blister. And with that, it's less than 0.5 centimeters. A bulla is the same thing, but it's larger than 0.5 centimeters. We talked about that fissure already and the ulcer there. Now, we can see nice little pictures in the book, but what I wanted to do was give you an idea of what they look like in real life. So you can see here with Ebola, they're large blisters. A macule, this is on the skin level. It's just a discoloration. A nodule, again, it's elevated. This is a patch. This is a vesicle. You can see that blister or that fluid inside there. Pustules. These are vesicles containing pus, so this is going to have infected material in it. Here's plaque. Again, it's superficial on top of the skin. Here's little papules, just little bumps. Here's a wheal. This is exactly what the wheal looks like when we do a PPD. Scales, again, we're going to see this with patients who have psoriasis, eczema, those kind of things. This is a crust, so there is a difference. The crust is like when you you scrape your knee, and as that serous fluid or serous sanguineous fluid drains, it actually dries and hardens, and it gets to be kind of crusty. Okay. Here's that fissure, that crack. And then the erosion, and we're not going to go with the others, just so you know. So here are the actual explanations. They are in your book. I'm not going to go through those again because we've talked about them. Now, as we talk about lesions through the skin, we're talking about a pressure sore. And so when we have a pressure ulcer, it is when we have prolonged pressure over a bony process. So this could be the tailbone, it could be the heels, it could be the back of the head, it could be elbows, and they are very, very dangerous because if we don't move our patients, this is why in nursing homes, your patients are turned every 2 hours because we don't want them laying in the same position to develop a pressure ulcer. You can see here a stage 1 pressure ulcer. It's red, ooky. Stage 2, we've got it open, but it's still staying in the top layers of the skin. Stage 3, we are down to the subcutaneous level. And stage 4, we are already down to the bone. And they are pretty. I was going to put a real picture, but they're very interesting looking, and I didn't want to gross anybody out. Needle stick injuries, again, accidental puncture is something that we will see. And an ulcer, again, open lesion resulting in tissue loss around the edges. An abrasion, again, just that superficial layer is scraped away. That fissure is crack-like. And a laceration is a torn or jagged wound. These are much more difficult to fix than a nice straight cut because of the jaggedness of the wound. Birthmarks that are out, that we may see out and about. There's pigmented birthmarks. And we'll say they're moles. The vascular birthmarks are the things probably that we notice the most. So when we look at a capillary hemangioma, this is when you have a soft, raised, either pink or red area that's a birthmark. Sometimes these will actually resolve. The blood will be, be absorbed into the body, and after a time, those may disappear. They don't always, but they possibly can. Again, this is a benign tissue mass just made up of blood, lymph, those type of things. But I've seen those where sometimes they will dissolve over time. We also have a port wine stain. And when we talk about the port wine stain, this is a vascular birthmark made up of dilated blood capillaries, and we get a very large red-purple discoloration. This is not going to resolve without treatment. So This could be treated by lasers, possibly light source, possibly, surgical removal of. Dermatitis is an inflammation of the skin. And again, we'll see contact dermatitis. This is anything. This is a general diagnosis. You've touched something and it's caused an inflammation in the skin. This could be from a plant. It could be from an animal. It could be from a new detergent. It could be from like wool or something. It's really difficult. They have to kind of rule out things to find out what's going on with contact dermatitis. Eczema is a recurring dermatitis that has redness, itching, and drying. Exfoliative dermatitis is a large, widespread scaling of the skin. And they actually have some pictures in your textbooks of psoriasis as well as contact dermatitis caused by poison ivy. Pruritus is actually itching that's associated with most forms of dermatitis. Even with mosquito bites, poison ivy, rashes, anything. You itch like anything. And so that's pruritus. Erythema is actually the redness of the skin due to capillary dilation. And there's a number of different types that are out there. Erythema, infectiosum is a viral infection in kids. It's also known as fifth disease. The multiforme is a general allergic reaction to an illness, infection, medication. And the perino is a large red-purple inflammation. It's when small blood vessels below the skin are damaged. Erythroderma is going to be a redness of the entire skin. Hand, foot, and mouth disease. This is so common right now. It is a viral infection in kids under the age of 5. And you talk about being contagious. It's crazy. So what they do, it's called hand, foot, and mouth disease for a reason, because you're going to see a rash on the hands, the hands, the bottom of their feet, and also they get nasty sores in their mouth and their throat. And that's usually what's bothering those kids more than anything. Again, it's a viral infection. It has to run its course. Dermatosis is, again, any skin lesion that's erupting, not associated with any type of inflammation of the skin. Ichthyosis is a hereditary disorder. It means it's a dry, thick, scaly skin. Lipedema is going to be an accumulation of fat and fluid under the skin of the hips and the legs. And systematic lupus erythematosus, it's SLE is the abbreviation for that. This is a nasty autoimmune disorder. And you can have very mild symptoms all the way to very severe symptoms. Causes a rash. You actually get something called the butterfly rash on your face, but it can affect your major organs. Some people have had to go on chemo to try to get things just to function properly with SLE. Psoriasis is, again, red papules with silvery scales, and they can flake off. You see, a lot of times people will see, they'll scratch their arm and there'll be large flakes of skin that may come off. Rosacea, tiny little red pimples that are broken blood vessels. We can see this in adults between 30 and 60 years of age. And rhinofigma is a bulbous nose. And so this is that hyperplasia of tissue on the end of the nose. We see this usually in older men, and this is not always, but can be one sign of alcoholism. Scleroderma is another autoimmune disease in which our connective tissue becomes thick and hardened. It is so difficult to watch somebody go through this. Urticaria, again, itchy wheals due to allergic reaction. This is those hives. It's what we would call hives. And xeroderma is excessively dry skin. Carbuncle. It's just a it's just a bunch of furnuncles. Sorry, I get so excited when we talk about these things. Furnuncles are also known as boils. So you could have one boil, which would be a furuncle, but a carbuncle is a number of those boils together. It is not a pretty sight. Cellulitis is actually a bacterial infection in the connective tissue. This can get very ugly very fast. You're going to be tired. It's going to cause major swelling. It's going to be hot. The skin is going to be hot to the touch. And there's going to be red streaks. That red streak means that there is a bacterial infection that is moving up the leg. This is very important that it's taken care of. We see this in a number of different issues, but cat and dog bites are something that we see because they have very dirty mouths and they're puncture wounds, and so it's hard to clean them. You're going to see the extremity probably double its size, and see that's when we say swelling, we're talking a large swelling. These people have to be put on major antibiotics to try to get rid of that bacterial infection, and hopefully that will take care of it. Impetigo is a bacterial skin infection. Again, common in children. It happens. When you have groups of kids, things are passed from child to child very easily because they don't have those personal space issues that we do. Necrotizing fasciitis, it's actually caused by group A strep, and it enters the body through a skin wound. The problem with this is that it will actually eat the flesh off of your body. It's actually known as the flesh-eating bacteria. So this has to be treated very, very, very quickly because if we don't take care of it, it can actually be fatal. We've already talked about furnuncles. They're large, tender areas, and they're caused by those staphylococcal infections, those boils. Gangrene is when we have death of a tissue, and then it's followed by a bacterial invasion. And again, this can enter the bloodstream. This can be a systemic issue, and the minute that infection gets into the blood, you can have a life-threatening situation. Usually gangrene is due to the loss of circulation to that area. We see it also can be if you've got frostbite, you can lose, your finger gets the cold has killed off the blood supply. But we see this a lot in our diabetic patients. With our diabetics, they have that loss of blood flow to the extremities that causes the neuropathy. And because of that, then they can get a blister very quickly, not feel it, and they can lose toe. Then they can go from the foot to below the knee amputation to above the knee amputation, or losing the whole leg. So this is really, really important that when we see that, we take care of it immediately. Pyoderma is actually an acute pus-forming bacterial skin infection, just causes nastiness. Mycosis is an abnormal condition of causing fungus. And tinea is a fungal infection on the skin, hair, or nails. And this is ringworm. And they actually show a beautiful picture of ringworm on page 381 if you have the textbook. It's figure 12.12 if you're using your ebook. It's a nice round patch, and it's interesting to look at. But yeah. Pediculosis is an infestation of lice. I hate talking about this because now I'm going to itch all day. And scabies is caused by a skin infection caused by itch mites. When we're treating lice, we need to make sure we not only kill the lice, but we kill the eggs. So what they normally will do is you put on whatever it is that you're using. They will run it through with a real fine tooth comb, and then they'll reapply again after the nits are hatch and before they're able to lay eggs to get rid of that. They are definitely something that's easy for people to pick up in the school systems. We don't make generalizations that they're dirty people because any of us can get them. Okay, skin growth. A callus is just a thickened part of the skin that's caused by repeated rubbing. And you'll see this especially in people who work really hard outside. And they don't have, or that, they have repeated rubbing of certain things. Cicatrix are actually, it's just normal scarring. The granulation tissue that's formed during the healing of a wound, it's actually one of the healing phases of when we look at some type of trauma to the skin. Dysplasic nevi, these are atypical moles. This is important because those are the ones we need to watch that can develop into skin cancer. A granuloma is a small swelling of that granulation tissue. Again, it could result in inflammation from an injury, an infection, and we just need to watch that as well. A keloid is a very thick scar, and usually people you either usually don't have keloids or you do. So if you scar really badly, you could just have the tendency to have keloid scarring. And it's not like if you would cut somebody in a nice straight line from an incision, most of us would heal. It would fade over time. You still may see it a little bit, but it wouldn't be bad. A person that keloids, it would be actually an overgrowth. It would be a bump where the scar was, and very, very different looking. Keratosis is an overgrowth or thickening of the skin. Kerato is the combining form meaning hard or horny. Not the horny you're thinking of, but like horny as in a hard growth that would come out of the skin like a horn. Okay. A lipoma is just a fatty tumor. Nevus are small skin growths developing from a melanocyte. Papillomas are wart-like growths on the epithelial tissue and other places on the body. A polyp is just like a mushroom-like growth from the surface of the membrane. And I would they're going to be more of a sac, where these skin tags are flesh-colored polyps that hang from the body. They have a really tiny, thin stalk. They are benign. They tend to come on people as we get older. Oh, it's heck getting old. Now we start growing these skin tags. They can be snipped off. Causes a little bit of a whoop. And there is some blood, so you have to be careful with that. But I also have known people who have them that actually tie thread, or some people tie dental floss around them, and then what happens is they will fall off because of lack of blood flow. Skin cancers, there are three types of malignant skin cancers. We have the basal cell carcinoma, the squamous cell, and the melanomas. Okay. And I'm hoping we talk about that. Um, Actinic keratosis is a precancerous skin growth due to sun-damaged skin. This is so important, and I know you guys probably love to sit out in the sun, but you really need to have sunscreen on. The sun can cause major skin cancers. Basal cell carcinoma, again, it's a malignant tumor of the basal cell of layer of the epidermis. The great thing about this, it doesn't usually spread. We just have it, we take care of it, take it out, and we go from there. Squamous cell carcinoma are malignant tumors of squamous cells in the epithelium, and this squamous cell carcinoma can spread very quickly to other body systems. Okay, malignant melanoma occurs in melanocytes. Remember, those are our dark cells. The initial symptoms are a change in the size, shape, or color of a mole. So if you have a large mole, you need to make sure that you are watching that, watching the color, watching the size. Is it starting to grow? It was a circle, and now it's starting to grow kind of weirdly. The one thing I have not put in here that I want to make sure that you know are the ABCDE of looking at moles. So it's ABCDE. We're looking at the asymmetry or the size. You know, is it round? Is it odd shaped? Is it growing weird? We're going to look at the border irregularity. If it's not round, are the borders, is it, going in all different kinds of directions? What color is it? So that's our C. The diameter, if the diameter is larger than a pencil eraser, then we definitely need to be seen and watch that. And is it evolving? So is it changing in shape, size, shade, color? So those are the ABCDEs for looking for malignant melanomas. That's a hint. So you may want to look at that. It's on page 383. Burns. Burns, again, are caused by heat, flame, electricity, sun, chemicals, radiation, all different types of things. The severity is going to be described by the amount of tissue it's affected, okay, or that's been involved. So here's our normal tissue. Wait a second, I can't get it, my mouse. Here is normal tissue. We see a first-degree burn. It's only going to be on the epidermis. It's going to be red. This is a minor sunburn, or you just touch it real quick to a pot. There's no blisters. There's nothing. That's a first degree. The second degree is deeper. You can see it's going down now a little bit into the dermis, and we are seeing blisters. The minute we see that blister, we know that we've gotten to a second degree burn. A third degree burn involves all the layers of the skin. So we're seeing that the epidermis, the dermis, and the subcutaneous level are absolutely being affected. And now there's a fourth degree, they've termed a fourth degree, where that burn actually goes into the muscle and all the way down to the bone. So again, first degree, just red. Second degree is blisters. Third degree, all layers of the skin. Fourth degree is all the way down to the bone. This piece over here is called the rule of nines. When we are diagnosing if a patient is burned, they're going to use the rule of nines. And you can see, so if we had the right arm burned, 9% of their body would be burned. If both legs were burned, 36%. 36% of their body would be burned. So you have to look at that. For kids, it's a little bit different You can see their head's 18, where ours is only 9%. There won't be any questions on that, but I just want you to know if you ever hear anything about the rule of nines, this is what they're talking about when they're diagnosing the percent of the body that's burned. Diagnostic procedures, a biopsy. So we'll just remove a little bit of the tissue and send it off for them to determine if it's benign or if it's malignant. Exfoliative cytology, cells are scraped from the tissue, and so we can look at them then under the microscope. Preventative measures, I've already got on my soapbox about this. Use sunscreen. My husband uses oil. He gets yelled at by Dr. McCall all the time. I have to use like 70 because I am so fair skinned. So please make sure you're using sunscreen. It blocks the ultraviolet light, and that's what causes not only the burn, but can actually affect the cells and affect you later in life to develop different cancers. Burn treatment, depending on the depth of the burn and the percentage of the body involved. If we have a severe burn, they're going to go to a burn center. And again, they're going to be on major pain meds. They're going to have to debride them, which means that they've got to clean them up, go in there, clean it, cut away the dead skin. They do that on a regular basis. There may be some dermoplasty. They need IV fluids. They have lost tons of fluid through these burns. They need to be fed that nutritional supplement. They most definitely need antibiotics. After they're healed, they may need some cosmetic reconstruction, maybe some skin grafts, those type of things, and they may need to go into rehab. They may have to learn, depending on the degree of severity, how to walk again. And it's really awful to watch somebody go through burns. There's different ways to do tissue removal. We can cauterize it by burning it. We can do a chemabrasion, which is using chemicals. We can do a cryosurgery, which is freezing it. And then we can do a curettage, and that is removing the surface materials by scraping it. We can debride, we just talked about that, removing the dirt, foreign materials, damaged tissue by cutting it. It helps prevent infection. It actually promotes healing. It's irrigation and debridement, I&D. We clean it, we pressurize the fluid around that, then we cut it and clean it up, and then we will do that however often the doctor orders it. Dermabrasion, again, we use a wire brush. And yes, they use these on people with burns. It is horrible. If you've never been in a burn center, you will hear people screaming as they go through these treatments. Electrodesiccation is actually the destruction of tissue by using a spark, and an incision is cutting into something. You might see this using the electricity to do different types of treatments throughout different body system. Mohs surgery, you may hear this a lot. What they do is they remove the part that's affected, and then they look at it under the microscope. If it shows cancerous tissue, they go back to the site, they remove more tissue, look at it under the microscope. They continue to do that until they no longer see any type of cancer cells. So they keep going as deep as they need to get rid of all the cancerous cells that they can see. Different types of treatments are laser. Again, and you'll see that stands for light amplification by stimulated emission of radiation. These lasers actually emit lights at different wavelengths, and they can actually treat diseases. There's amazing light therapy for patients with eczema and psoriasis that work beautifully. Photosensitizing drugs, we actually, you can be topically, which means put them on the skin, or by injection. After activation, the drug produces a form of oxygen that kills nearby cells. Retinoids are the things that we usually use on our face. They are derived from vitamin A because they really help promote epithelial cell growth. So for us women, older women who have saggy skin, they tell you to use retinoids to help make your skin more supple, and it will fill out your wrinkles. Topical steroids, we use steroids for a number of dermatologic treatments. They're going to stop the itching, stop the inflammation. Again, it's a derivative of a natural corticosteroid hormone, and you're going to see it used in multiple different diseases. Some of the cosmetic procedures that you're going to see, blepharoplasty is actually an eye where they get their eyes, done to remove all the saggy skin. We know Botox can be injected to get rid of the frown lines, but Botox is being used to treat migraines and muscle spasms, and it's actually very successful. It's a lot because you get a lot of different injections into your scalp for the migraines, but it's really been very successful. There's collagen replacement therapy, and you use that for soft tissue augmentation, and dermoplasty, replacement of damaged skin of a patient with a healthy tissue taken from a donor site. So let's say we have a spot on our arm that we have a wound, we need a graft or a patch of skin to cover that. They can take it from our leg, put it on our arm, and we can help, it will help heal. Last but not least is the electrolysis, and that's the use of electric current to destroy hair follicles. One of the things that you need to know, that does not work on gray hairs. So people who want to get electrolysis but have gray hair, it doesn't help. Lipectomy is a surgical removal of fat. So that's going to be where they, I'm at loss for the name right now, but liposuction, which is the next one, which is where they go in and they jam the suction catheter underneath the skin. It's very, very interesting to watch. The one thing with liposuction that we have to remember, it's not just sucking out the fat, but there's blood vessels there as well. So it can affect bleeding and those type of things. Rhytidectomy is a facelift. It is when we remove the excess skin and fat from the face. Sclerotherma, this is really cool. This is being used with varicose veins. They actually inject saline into the varicose vein for the spider veins, and it helps them disappear. If you're interested in looking at that, you can Google it because it really does take care of it almost immediately. From what I understand, it is painful, but it is less painful than having the varicose veins. Other than that, just make sure you're looking at your abbreviations at the end of the chapter. And that's it for the integumentary system.